Dr. Gulani, when I was doing research to make my decision on who I wanted to do my advanced laser surgery with, I noticed that I actually had to do a lot of research that other laser surgeons advertise, TV commercials, newspaper ads. Why don't you advertise? I actually had to work at researching.
I'm not against advertising, Jason, but I'm so pleased with the way I practice that patients do their research. They fly here from all over the world, literally. I love this question and answer sessions that I do with patients, just like with you. Help them understand what's the best technique and then get the results that we both team to go for. That's my real gratification in the way I practice. As you know, making people see is a passion for me. I do know many patients are forcing me literally, wanting me to start advertising and stuff, and I may eventually do it, but I still want that to be in an elegant, educated manner rather than jumping from rooftops and saying I'm the best. For finding out whether your surgeon is the best, I rather let the patient decide. With the internet, things are so transparent nowadays. You can just Google your surgeon, find out if these are the two things about the doctor, meet the doctor, get the feel for, is this real? Does the doctor know what he's saying? Does he have my best interests in his heart? And those are important things. And so eventually we may, but I truly love what I do.
How important is it to ask when you go in for your consultation with the laser surgeon, meeting with the surgeon and asking the tough questions? How important is that?
Very important. Jason, coming from your background in law, as you can see, you don't want to end with the problem and then wonder about those questions. So prevention is the best medicine here, and I cannot reiterate anymore. These are your eyes. These are not, you cannot afford to have a mistake, even if naturally there's a rate of complications here. So you must meet with the surgeon. You must ask every question that you have. Even questions like, doctor, why are you selecting this technique for me? Is this the best that I have? Can I fly to some other place in the world to have a better technique? Should I wait a few more years till I'm young and then wait for the best thing to come? And questions like, doctor, what are my long-term outcomes going to be? If I have a bad outcome or a complication, can you handle it or will you ship me far away? Things like that I think are very important because, as you yourself have mentioned, Jason, before, these are things that empower the patient. And the side effect of this empowering is that you lose your fear. Because now you know that you and the doctor are a team, working for the best surgical outcome, keeping your long-term safety in mind. So I believe questions are absolutely.
One of the things I actually learned from you is that there's so many different kinds of LASIK surgery, so many different variations, so many different types of laser vision correction, traditional LASIK, different technologies. Why is that important to know all the different kinds and to be able to perform all different kinds for your patients?
Very important, Jason. As we know, there are no two eyes that are alike. By that concept, there could be no one cookie-cutter surgery for everybody. Now, let's answer this question in different levels. LASIK has, fortunately or unfortunately, become into a commodity with the amount of advertising and hype that's around it. So it's like, like Xerox. I'm going to Xerox this for you. What you mean is I'm going to copy this page for you. I'm going to FedEx this to you. What you meant is that you're going to mail it to you. So LASIK has developed that kind of recognition that doctors have learned just this one technique, and because of its lucrative business, if you may, it's become a very easy way to function. LASIK actually, as you learned, is the way I like to teach it is it's actually a number of laser vision surgeries, and LASIK is one among them. The laser vision surgeries are different kinds based right from technology to technique to approach and what kind of procedure you're going to perform on the patient. Laser vision surgeries again are a subset of what I call vision corrective surgeries under a much bigger umbrella, which could be not only LASIK but lens-based surgery, let's say cataract surgery. Let's say a patient who cannot be corrected by LASIK, who has thin cornea, you can do a phakic implant or an ICL or a contact lens in the eye. So all these concepts are called vision corrective surgery. Take it to a still higher level is this super specialty that I've created for LASIK surgeons called Corneoplastique, which is now published for over 6 years. With this concept, what is very important is if as a surgeon you know all these techniques, one, you will select a technique because it is best suited to the patient and not just because that's all you know. Number two, your comfort level in moving in the techniques will be so easy because let's say you're somebody who's 65 years old and comes from LASIK, but with Pentacam technology you see early cataract. Now you rather ethically and honestly do a cataract surgery and make that guy see without glasses than do LASIK. Also, you can combine surgeries. Somebody who's had cataract surgery, you can do LASIK on top of it. Somebody who has ICL surgery, you can do LASIK on top of it. Somebody who has keratoconus, you can do intact rings with them. Now, a third dimension to this importance is you can also reverse complications. So, as you know, in my practice, we have a high number of people who fly from everywhere from bad outcomes and come here seeking opinions. Once you know all these techniques, you can reverse the surgery and their complications like LASIK complications and make them see 20/20 once again. So if you see the expanse is so deep, LASIK is not the only surgery, it is one among many laser vision surgeries. Laser vision surgeries are among vision corrective surgeries. Vision corrective surgeries under the umbrella of Corneoplastique. Now you're talking unlimited combinations and permutations of surgeries where nearly everybody, in a way, is a candidate for refractive surgery.
Dr. Gulani, I want to let you know why I chose you as my laser vision surgeon.
Okay.
And first of all, the technology that your practice here at the Gulani Vision Institute employs, the Pentacam technology, which is like a CAT scan of the eye. It gives me the reassurance that we're going to make the right decision in which method to use and what the possible outcomes and all of the important factors that I expect to know that we're going to make the right decision. Also, the personal touch that you and your staff gave me, it was absolutely great. You were there before the surgery, during the surgery, after the surgery, and even for all the follow-ups. I actually got to see you, I got to talk to your great staff, and I felt so comfortable here. It's kind of like being part of a big family, and I really appreciate that. Also, one of the things that really helped convince me to choose you as my laser surgeon were your innovations in the fields of laser vision correction and advanced laser surgeries, your invention of LASIK tools, your expansive research that you've done on all different types of laser vision surgery, advanced surgeries, cataract surgeries, corneal transplants, all of the technologies that you employ, that really, really helped convince me that you were the right surgeon. And I think I made it. Actually, I don't think. I know that I made the right choice. And I'm so happy for the outcome. Being a law student, my eyes are very important to me. Having to read the professor's notes and having to read case books and case law, and I use my eyes a lot, and it's they're very important to me. And I've gone from 2400 to 2015, and I want to thank you for that.
Well, it's an honor, Jason.
Thank you.
Like I've always said, I'm indebted to my patients, you included, Jason. It continues to amaze me that surgical innovation, when you tie it with passion, and the result is vision, to me that's priceless. So again, it's been an honor, Jason, and I thank you so much for tuning in.
Thank you.